Health started, and we're grateful that everybody's here. I'm going to go around, do a roll call. Start off with Doris Ralston,
Here.
Commissioner Bremer,
Here.
Dr. Chan,
Here.
General Briggs,
Here.
Councilman Donaldson,
Here.
Commissioner Gonzalez. I don't know if we've heard anything from him. We have not.
He's out this week.
Okay. Mayor Habener
Here.
and Dr. Vu.
Here.
And I am here as well. Ted Colas is present. We need a motion and approval of the agenda. Hopefully you've all had an opportunity to look at that.
Make a motion to approve the agenda.
Thank you. That's from Glant. And
General
a
Briggs, second.
Thank you, General Briggs. All in favor of accepting the agenda as it's presented, let it be known by saying aye.
Aye.
Aye. Any opposed? And there is none. Okay. Michelle, do we have any public comment?
I have no public comments.
Okay, we're going to move on. And I want to give an opportunity, before we get too far, to see if any of the board members have any comments, anything that you'd like to bring forward. Looking around, not seeing anything. I think that the only thing I'm going to bring forward is that to remind all of our board members, if you looked at your packet, we've got a very full agenda today. We've got 14 contracts. Fortunately, these are contracts that are ongoing. This is payment that we've received before, and everyone, I think with the exception of Dr. Chan, has seen every one of these contracts come before us before. So the presentations, because there's 14 of them, they're going to be a little more brief. And we encourage and welcome engaged board members and lively discussion and questions. But please keep in mind, we've got 14 of these to go through. So if you have specific questions, I know that you can email those to Susan and her team, and they would be very happy to follow up with specific questions that you have moving forward. On top of the 14 contracts, we've got 2 resolutions. And the resolutions are, we have been reading all of our resolutions into the minutes. And just let the board members know, we don't have to do that. We are not obligated to read the resolutions. You've all had an opportunity to see them, and so we don't have to read them out loud into the record unless it is something that you would like to have read into the record specifically. So we have 2 of those today, and if you don't want those read into the record specifically, we will just vote on them as they have been presented to us. Let's see, anything else I wanted to mention? I don't think so. I think that's it. So that takes us, I think, all the way to our financial report. Oh, and on top of our 14 resolution, or 14 contracts, 2 resolutions. We've also got the auditor's report today, so.
The minutes of the last meeting.
Oh, are they on here? Oh, approval of the minutes. Okay, we need a motion and second for the approval of the minutes.
Doris Ralston, so moved.
Thank you, and a second.
General Briggs, second.
Thank you, General Briggs. All in favor of approving the minutes, let it be known by saying aye.
Aye.
Okay. All right, I think it is time for our audit presentation.
Good morning, Board of Health. Okay. Good morning, Board of Health members. Nikki Simmons, Chief Financial Officer. Here this morning to give you all the results of our 2023 fiscal audits. We engaged the firm of Rubin Brown, an independent CPA firm with offices throughout the nation. With us this morning is Ted Williamson, a partner out of the St. Louis office of Rubin Brown. And before I turn this over to him to give you the results directly from the auditors, I just wanted to express sincere appreciation to the staff of not only the Financial Services Department from El Paso County who handle all of your finances. That's, okay. that's different than when I walked up. Cool. That's what I thought, but I wasn't sure. Okay. But anyway, I wanted to express sincere appreciation to the Financial Services Department who handle all of your finances, as well as every staff member from Public Health. This audit is not just a reflection of the work done in financial services, but every single department within Public Health who handles money, which is every one of them. Every grant is looked at by my team, and then Ruben Brown comes in and audits specific grants with federal standards as well as generally accepted accounting standards. A lot of work goes into ensuring that you have clean financials. And the result of all of this means that the financials that you're getting on a monthly basis that you use to govern this organization are accurate. And that's essentially our end goal. So thank the financial services team led by Debbie Perry, as well as Jody Pinnell. And if there's any other questions from me, I'll hand it over to Ted Williamson with Ruben Brown.
All right, well, thank you. Good morning, everyone. Again, my name is Ted Williamson, partner with the accounting firm of Ruben Brown, and we did the audit for the Public Health Department's financial statements for the year ended December 31, 2023. So we're here to share the results of that today, and I think you'll see that it's good news. Everything went very smoothly as I talk about it here. There are two parts to the audit, and I'll touch on them each briefly in turn. The first is the audit of your financial statements, and then the second is what's called the single audit, which is a compliance audit with the provisions of federal grants that you've received. So first, as far as the financial statement audit is concerned, the purpose of that is to determine that your financial statements, as Nikki said, are fairly presented in accordance with generally accepted accounting principles as set forth by the Governmental Accounting Standards Board. And when we do the audit, we follow the audit standards set forth by the American Institute of Certified Public Accountants, as well as, because of the level of federal funding you receive, we have to follow what's called governmental auditing standards that are set forth by the Governmental Accountability Office of the federal government. It's important to note that while we do issue an opinion on your financial statements, ultimately the management of the department is responsible for the accuracy of those books and records. And additionally, while we consider your internal control structure when we do the audit, and we would bring any issues we identified to your attention, our opinion is on your financial statements and their accuracy. We don't issue an opinion on your internal controls. But with that background, we're pleased to report that we did issue what's called an unmodified or a clean opinion on your financial statements. Additionally, we did not have any difficulties or disagreements with management during the audit, nor did we identify any corrections that had to be made to the financial statements as part of the audit. So that's very good results on the financial statement side. Additionally, on the single audit, which I mentioned, is a compliance audit related to your federal grants. During 2023, Public Health spent $26 million of federal awards. Now, we do not audit every federal grant every year. The federal government has a formula we have to follow to determine which grants we look at. For 2023, it was the American Rescue Plan Act, obviously, which has been a big one, and then two Health and Human Services grants, the Building a Resilient Health System and the Emergency Preparedness Grant. And I'm pleased to report we did not identify any instances of noncompliance or any internal control issues as a result of the single audit. So again, very good results, a clean audit. I think that speaks very highly of the diligence with which management maintains your books and records. So with that, I'm happy to answer any questions that you might have.
Thank you very much. Look around the board and see if there's any questions from anyone on the board. General Briggs.
General Briggs for the record. So thank you very much. In your analysis, has this board been supportive, or were there any issues that you saw from this board that would improve our support to the staff and to the execution?
Yeah, we did not identify any issues as it relates to board and management interaction. And in fact, as part of doing the audit, I'm required to speak to at least one board member, and Ms. Bremer and I spoke as part of wrapping up the audit and did not identify any issues there.
Okay, Dr. Vu.
Thank you. This is for my own understanding. I apologize. I might have asked this before. I just can't remember. What's the difference between the balance sheet and the net position statement? And there's something restricted, unrestricted. Can you explain that
Sure.
to me?
So essentially, governmental accounting requires you to present two versions of the financial statements in the same document. The first two, which includes the statement of net position, have more of a long-term focus, and it has your, your fixed assets, your debt on that balance sheet. Then there's the balance sheet that's more of a short-term focus, which excludes long-term things like capital assets and debt. And that the focus there is just, are you staying within budget during the course of the year and that type of thing. And then certain of your grants and other external funding sources place restrictions on how that funding can be used. So that amount is reserved within the equity portion of your balance sheet.
How far out does the net position statement project?
Well, it's intended to give you a picture of whether your long-term assets minus your long-term liabilities, how much of a net difference there is there. So it's not really that it's looking into the future, but that the long-term assets you have as now, like your capital assets that will depreciate over many years, and then the debt that you have to repay over many years are reflected on there.
I think I somewhat understand. I'll ask again next year.
Sure.
Thank you.
Absolutely. Happy to talk to you about it offline, too. That would help.
Any other questions, statements from the board?
I have no other questions, just I'm going to reiterate thanks to your team, and then thank you to Nikki and the financial services team. And I made this comment when we were presented with the countywide audit earlier this week as well, that really this involves every single employee. So here, Department of Health employees, we depend on you to make sure that we're doing things in a transparent and open and recorded way. And then the financial services team can do with that. What you're making the work happen for our citizens, we also have to keep in mind the financial aspects and everything behind the scenes. So it actually takes every single frontline employee doing their job and doing it very cleanly, very well. And so I, as a county commissioner hat, appreciate that. As a Board of Health member hat, very much appreciate the work that goes into making sure that our El Paso County citizens know exactly how we're working for them, and then it is just open and transparent. So I'm looking at a lot of employees in the audience here, and I can't see Nikki and Sarah and others, but thank you very much. We also depend on the collaboration and the communication back with those teams. So the other thing I'll point out is that the ARPA funding, it's a significant amount, incredibly complex. Actually, all the Department of Health and Department of Human Services funding streams are incredibly complex. The ability to keep those exactly what they're intended to be spent on is impressive. So thank you to all of you who do that. And that's it. Thank you.
Great, thank you. Kind of stole my thunder. I was going to say a short auditor's report is a good auditor's report,
That's exactly right.
Been through enough of these that we're very grateful for that. Thank you for your staff and what they did. And to reiterate what Commissioner Bremer just said, a clean audit report doesn't happen by accident. It happens because of diligence on the part of the staff, and we're really grateful to be able to sit here and have a clean and very short auditor's report. And then, again, didn't happen by accident. We recognize that, and we appreciate the work of the staff. Thank you.
Thank you very much.
And that it's typically unusual.
Yeah.
That's typically unusual.
Especially with a braided funding stream like we've got, that you got funding coming in from so many different angles, not easy to keep track of.
Well, and especially with expenditures of having to finish up the ARPA funds, it's really unusual to have a short.
Okay. Well, thank you all. We're going to move on to number 7 on our agenda, which is the Finance and Budget Report.
Good morning. My name is Sarah Kinney. I'm the Budget Supervisor for Public Health. Next slide. As you can see, for the month ending May 31st, 2024, our revenues are on track. El Paso County and state local public health agency funding is as expected, so no anomalies there. I do want to note we have excellent execution on our program-specific grants. This is really a testament to the public health managers. I've been working closely with the finance team and the public health managers who have grants, and they've been working diligently to execute those funds and bring in that revenue. So I just want to thank the team. You can see that we have a slight variance there, and that's because we are working really hard to finish that up as the state fiscal year ends here in June. Our license fees and permits continue to trend a little bit high. Part of that variance is due to retail food establishments, which has a higher annual licenses towards the beginning of the year. I do anticipate that that variance will decrease over time, which we're continuing to see month over month. Our Medicaid fees and insurance are also a positive. We've had an intentional focus on billing there, and we've also had a slight increase in immunizations in the reproductive health clinic, leading to some additional billing. So really an excellent story here for our revenue. Our interest income is also up, and that's largely due to slightly higher interest rates and your very healthy fund balance, your reserve. Moving on to expenditures, we continue to see some vacancy savings in personnel. I do want to note that I am not anticipating that we will have large vacancy savings by the end of the year. And I did do some analysis on this based off the board's inquiry. I'm working on a full report with Rachel Lyon, and we'll be presenting that in August to the board. But I did look to see how many vacancies do we have and what's our total authorized staff. So currently, as of the last payroll, the public health full-time equivalents are at 196, and our part-time equivalents are at 15. At this time, at the last payroll, we only had 8 vacancies, which is 3.8%. When you look nationwide at vacancies for organizations in the healthcare sector or in public healthcare, vacancies run at 10.1%. So this is really a testament to the strong execution of our leadership team and our staff, and really what a great place El Paso County is to work. So in looking at those vacancy savings, these are below average of what you would expect for an entity of our size. I just wanted to address those items, and you'll be seeing a more detailed review of our team in August timeframe with that report. I'm working with Rachel Lyon. In terms of operating, we're doing well there, and capital as well. Are there any questions overall on the financials for May?
General Briggs?
John Briggs for the record. Are we seeing any impact yet in the budget to the changes in the fee structure that was approved by this board?
So I am doing a comprehensive look at all of the fees across the agency under the direction of Director Whelan. We are increasing the fees that were approved by the board for environmental services, which you were briefed on, I think, in October of 2023. But there's been no changes to the fees relative to anything the board has directed.
So can you remind me when those fees take effect?
Those fees phase in over time. I can follow up by email with this. There's a number of different fees
Okay.
within environmental services, so I'll follow up.
But when do they kind of start? At the fiscal year or?
I understood that the board made a decision to make them effective January 1, 2024.
Okay.
And so, given that, we're in the 6th month, let's come back to you and get some more detailed information around how that is going.
Right, because I see the increase, and I just wonder
Right.
if that has had any effect.
So the increase primarily, when you look at the that number, we have annual retail food establishment license fees, which those fees are set in state statute. The board has no authority to increase, but there's a big push in the beginning of the first quarter, and that's what you're seeing there. That's going to level out. So as far as the other fees that were increased, we'll need a little bit more time to do some analysis on that. That's a good question, and we'll come back with that. And then with our Board of Health work session, hopefully we'll be able to have some insight into that on August 7th. I did
Dr.
want to
Boo?
mention also around the vacancy variance also. We are always lagging as it relates to invoicing our funders. So for example, we've got 45 days usually with many of the grant funding that we have. So we're lagging on billing to get reimbursement to show a true number. So know that number is always lagging. So when you're seeing the variance of $674,000, that is not a true number. And I shouldn't say not a true number because I see Nikki squinting her eyes over there. Oh, okay. But this is a May financial, and we are in June, and so if we were look at that number, it's just lagging, and I want you all to know that because some of these numbers, we do our best job to give you estimates and a snapshot of where we are, but there's many intricacies as it relates to how we're billing for the grants and to recover some of our costs.
And Dr. Vu.
Thank you, Sarah. I appreciate you and your team so much. Thank you for doing such a great job. I have two questions along the same lines, licensing fees and permits and vacancy. Licensing fees and permits, the increase in the variance, is it because of combination of volume and the higher rate? Has volume gone up, I guess?
So there is a seasonality to some of these licenses and fees where at the beginning of the year, restaurants renew. And so that we have a higher volume of these towards the beginning. So what you're seeing here is that our trend of what we projected might happen is slightly different than the actual licensing volume that we anticipated. And so analyzing that, I do expect that variance to come down over the year to come more in line. So I don't expect us to have $194,000 of additional licensing revenue. So I wouldn't say it's a true increase.
We'll
We'll continue to monitor it
Your-
through third quarter.
Thank you. And that your expectation of the variance to go down, is it because your expectation of volume to decrease? Or is it
that
other
would-
reason?
Yes, that would be correct.
Okay, thank you. Vacancy, I see that our vacancy percentage is low. Do you know what our turnover rate is and how it has trended over the past several months?
I know that was a question at the last board meeting. I am working with HR to get some of that data, and what we will do is prepare that information and present it on August 7th, and then from there we will have routine reports. And I did want to note that, although we have a low, you said 3.5 vacancy rate right now, the past few years have been extremely unique, and we have had a lot of staff turnover, and I would venture to say nearly 50% in the last few years due to many different reasons, and we will provide that information to you all during the Board of Health work session on August 7th. But I think that is important because I've talked previously, and we even did a presentation to the National Association of Local Boards of Health with our president, Ted Colas, and our development officer about refreshing and rebuilding and rejuvenating. And we're still in the rebuilding phase for our agency coming through the pandemic and even in clinical services of building back where we used to be. So it takes time, and we'll discuss some of that in the work session. But I did want to note that we are working on the report. We will have that information in more detail, and we will plan to have a routine report on staffing in every monthly Board of Health report.
Thank you, Susan. So that turnover rate will be wonderful to see. Do we have a methodology ahead of time of how we calculate turnover rate?
Yes, we'll provide that. We'll provide how we calculate vacancy rate, attrition, turnover rate. We'll provide all of that information when we have the meeting on August 7th. So we're working on the same page, and we have to have special considerations because one of the things that we value here in our agency is internal promotions. And so note when we have an internal promotion, we're not going to count that as a turnover or a vacancy rate. We have to note internal promotions because that's what we want to see happen. So we'll provide insight into that, and then moving forward, determine what you all would like to see in the monthly Board of Health meeting. I'm sorry, the report.
And it feels like the last few months we've had a lot of retirements.
We have had some bittersweet retirements in the sense of some long-term employees who have been providing exceptional public health service to El Paso County, and so we are experiencing some retirements, and we'll have that as a category to provide that information as well.
Thank you.
I have a question. Given the expected decrease in the vacancy variance for personnel, and also taking into account the lag time regarding the invoices, are you still projecting by the end of the year that the expenditures will be more in line with the revised budget or the originally approved budget?
So my anticipation is that we will operate to the revised budget, and that is what we are targeting, what is approved by the board, the in-force revised budget.
Okay, thank you.
Thank you.
Okay, Sarah, thank you very much, and I think it's good news to know that we are at 3.8 vacancy rate, and the average nationally is 10%. But for the staff out there, when that vacancy is right next door to you, and you're having to pick up that gap, it still doesn't feel good, and we understand that. So we'd like to see that vacancy rate as low as possible, and we'll continue to support Susan as she tries to achieve that as well, because nobody likes to pick up the slack when there's a vacant chair next to you. So, thank you.
Thank you.
Okay, and that brings us to the approval of our contracts. And again, I have asked Susan and the staff to kind of give us just an abbreviated presentation. This won't be the in-depth presentation that we sometimes get from staff. So let's see, the first one is the Public Health Emergency Preparedness, and Janelle,
Hi.
you're on.
Okay. Good morning, everybody. My name is Janelle McNair. I'm the Emergency Preparedness and Response Program Manager here at the Health Department. And as stated in your board packet, there is a contract synopsis. This morning, we are seeking your approval for the CDPHE grant renewal of Public Health Emergency Preparedness Program funding in the amount of $586,236. This will be used in the state fiscal year of 2024 and 2025. This renewal enables us to continue our work, which supports efforts to prepare for, respond to, and recover from all hazards events that pose an imminent or potential threat to the health, medical, and environmental needs of El Paso County residents. The contract was first approved by the board in 2002. The grant is renewable for 5 years, and we're currently seeking approval for our 22nd annual renewal. We look forward to continuing our work to prepare for and respond to emergencies that adversely impact public health and environmental quality across the most populated county in Colorado. Are there any questions about the Public Health Emergency Preparedness Grant?
Jenna Briggs.
Can you just confirm again the amount?
Yes, it's $586,236.
Isn't that last year's?
I have 596.
Yeah, you're reading what we see on our screen is the previous contract amount is what you're reading, and then the new contract amount is $596,408.
You're correct. It is $596,408. Thank you for that question. Last year was $586,236.
Yeah, there's like 10 grand there we want to make sure we're getting.
Yeah, it's a 1.7%
We want to squeeze
increase.
that turnip as much as we can. The other thing is, are we voting on these individually or as a group?
Well, good question. And let me think about that while Dr. Vu asks his question. Okay.
This this question came up in the past, the indirect percentage, and it's included in many of our contracts. Can you just explain that for us again from the beginning so that we are clear from the beginning?
So the indirect rate is a rate that is, I believe it's negotiated every year. It's different. So this year, starting January 1st, it's 17.91%. That's taken out of our contract across the top amount. And if there's a more in-depth, okay. And so every year that amount automatically comes out of our contract.
And that's for indirect support. So for example, information technology support, human resources, finance, budget. So that's all. The indirect is anything that does not provide direct service. And in our agency, if there is an indirect amount that is presented, we use that indirect, and it's all different from the federal to private grants to the state.
And didn't public emergency preparedness receive ARPA funds that will be then going away? I thought
No,
they
we
received
did
some
not.
ARPA funds as well.
Our program did not receive ARPA funding, yes. So our program is funded through the Public Health Emergency Preparedness Grant funding and the City's Readiness Initiative, which I'm going to brief next.
However, I think what you might be thinking of is that with our agency, we did use ARPA funds for emergency response as it relates to COVID and some of the other COVID grant funding, and that's winding down. And then the ARPA funds expire the end of this year.
And
I guess that's basically my question, with all of these things that were supplemented by ARPA funds that are now diminishing and going away, are these new numbers sufficient to run their departments when the past 3 years they've had ARPA supplementation?
so for our program, it is. However, I do want to note that we do have one emergency management specialist on our staff that has always been funded under county funding, which they've been receiving ARPA funding while it was available. This was a critical needs position that was approved right prior to the pandemic. So we do have that one position, and they are continuing to be counted under the county funding moving forward. So there's no financial impact to the Emergency Preparedness Response Program with the ARPA funding going away.
And overall, I think it's important to note that we've been very mindful of our staffing and the funding that we receive over the past few years and how it's winding down. And every position that is vacated, we evaluate to determine if that's the right position that we need as we continue to transition and rebuild our agency. And we've been very mindful in all programs. And then we did get some additional funding through the Public Health Infrastructure Grant. So it's always a kind of a juggling act as it relates to staffing what we need, but we are mindful of that with all of the different grants because many of the grants do not cover their costs.
I get it, that's why I'm saying with that money winding down, were those all taken into account with these so that these aren't underfunded?
Yeah, and I don't believe it's in our control to change all of the grant funding to make up for the loss of the ARPA funding, but we've talked about that, Susan and I and Doris, and we know that the ARPA funding is going away, and every department is mindful of that and looking at where that funding, what it's not going to purchase in the future, and making adjustments.
But, I agree, but the other thing is when there is a need, when there is a real need that isn't budgeted for, that comes up short, we do have a good fund balance.
We have an extremely healthy fund balance that's probably around 30%, and the board policy is around 18 to 20, and a lot of that is from the vacancy savings, and we'll have discussions on that during the Board of Health work session. So yes.
Okay, Cammie? Okay. All right, I'm going to answer General Briggs' question. Yes, we're going to vote on them individually because with the discussion, I think we can lose track of where we are if we don't vote on them as they come. So all in favor of accepting this contract moving forward, let it be known by saying aye.
Aye.
Aye. Any opposed? And there is none. Passes unanimously. Thank you, Janelle. And you're doing number 2 also, or
I
number
am.
B, sorry.
Yes, okay, so, also, we are seeking your approval this morning for the CDPHE grant renewal of the City's Readiness Initiative Program funding. This amount is $171,440. It will be used in the state fiscal year of 2024-2025. This renewal enables us to continue our work, which supports efforts to prepare for, respond to, and recover from large-scale public health threats and emergencies which require life-saving medications and medical supplies. This contract was first approved by the board in 2010, and the grant is renewable for 5 years. We are currently seeking approval for our 14th annual renewal, and we look forward to continuing our work to advance preparedness and response capability within El Paso County. Are there any questions about the city's readiness initiative?
Okay, General Briggs.
Thank you. General Briggs. So, not now, but I would appreciate some sort of like overview, something to catch us up on development of plans, testing, maintaining plans, something that gives just, maybe during the work session or something like
Sure.
that would be good. And can you confirm the amount again?
Yes, $171,440.
All right, thank you.
Councilman Donaldson?
Yeah, thanks, Mr. President. Can you just briefly state what obligations we incur with this grant?
So with the grant, with just the city's readiness initiative, we receive a contract from the state, and then there's deliverables and a scope of work associated with that. So the primary focus of this specific scope of work is planning for mass prophylaxis distribution. So within the county, if we were to have an emergency where we had to get emergency medical countermeasures out to the population within a certain amount of time, that we maintain points of dispensing plans and close collaboration with our Office of Emergency Management to be able to obtain those medications from the state through the Strategic National Stockpile, if that's the method they will be coming down, and making sure that, that we're ready to execute those plans if we need to. So as an example, we utilized our Strategic National Stockpile plan during COVID when we received personal protective equipment from the Strategic National Stockpile to support, although it was in very limited amounts, we know that, because the whole nation was experiencing the same emergency, but being able to distribute that equipment to first responder agencies, hospitals, health and medical facilities all across the county and be able to support. So that's what this scope of work primarily does, making sure that we are planning, training, and exercising those aspects of that part of this work for emergency medical countermeasures and mass distribution.
Okay, that's a good summary. Thank you.
Okay, thank you. And Cami very graciously reminded me that I didn't ask for a motion or a second for the first one before our vote. So I'm going to go back and do that, okay? So I need a motion and a second for, this is for the Public Health Emergency Preparedness Contract.
I'll make a motion to approve public health emergency preparedness grant.
I
Thank you,
second.
Mayor. And Doris with the second. Now, all in favor, let it be known by saying aye.
Aye.
Any opposed? And it's still passed unanimously. Okay, moving on to B, the city's readiness initiative. And I need a motion and a second for that.
Move to approve the funding for the City Readiness Initiative.
Thank you, Jenna Briggs. And that was Glenn with the second. And all in favor, let it be known by saying aye.
Aye.
Aye. Any opposed? None. Thank you, Janelle.
Thank you.
Moving on to the environmental health, retail food, childcare, and school programs.
Good morning. I'm Melissa Rogerson. I'm the program manager for our school's childcare, waste hire, and body art programs. Nice to see you all again. So as you see in your board packet, in the contract synopsis, we are seeking your approval for the CDPHE grant renewal for retail food, childcare, and schools program in the amount of $95,000 for the state fiscal year, July 1st, 2024 through June 30th, 2025, to continue our work which supports environmental health in completing required inspections, assuring compliance of applicable regulations for the retail food, childcare, and school programs. This contract was first approved, this specific contract was first approved by you guys in June of 2023. The grant is renewable for 5 years, and this is our first renewal of this current contract. We look forward to our program's continuing prevention of foodborne illness and communicable diseases and building partnerships with our retail food, childcare, and school industries. Do you guys have any questions for me?
Just the noted number change that it's gone up by $50,000.
Yes.
We usually don't see that kind of an increase.
Yes, and it hasn't increased in many years, this contract specifically, but this was increased because of the lobbying done by CALFO and the Office of Public Health Practice Planning and Local Partnerships at the state level. So this increased across the whole state for all of these contracts. Everybody got, and they're separated by how big our counties are, and so every different county got an increase as well.
Questions, board members? Okay, I'll take a motion and a second to approve this contract.
So moved, Councilman Donaldson.
Thank you. And a second?
Second.
Thank you, Mayor Havener. And all in favor, let it be known by saying aye. Aye. Any opposed? No. Well, thank you, Melissa, for your presentation. And are you staying with us for
Yes,
the
I'm
next one?
next
Okay.
again.
El Paso County Waste Tire Inspection.
Yes. So much like the last contract, we're seeking your approval for another CDPHE grant renewal for the waste hire program in the amount of $25,148 for the state fiscal year through June of 2025 to continue our work, which supports us in completing required inspections of waste hire generators and haulers and ensuring compliance of the state regulations. This contract was first approved in June of 2021, and the grant is renewable for 5 years, and we are seeking our 3rd annual renewal of this contract. And so through continued inspections, we look forward to preventing improper disposal of waste tires and the associated outcomes of improper disposal. Any questions?
Go ahead. So General Briggs, I really don't have any contention with this. 330 waste tire facilities? So what constitutes a waste tire facility?
Sure. So the majority of a waste tire facilities that you would know is like a big O tire, anywhere where you get a new tire and somewhere where they take off your old tires. So anywhere that generates old tires that can either be reused, so those would be used tires, but as soon as they're deemed waste, that would then constitute a waste tire generator. So a lot of your tire facilities, but even some mechanics that take tires and all that will accumulate into our generators. And then we have our haulers that add to that as well.
Okay, then I have a follow-up rock dumb fighter pilot question. Are these just vehicle tires or are they like bike tires? And
It's mostly trucks and vehicles, yes. So like some like tires, but bike tires aren't included in
Okay.
the set of regulations. Yep.
Okay, we need a motion and a second to approve.
I'm happy to make that motion for approval, but I would just like an example. I think General Briggs would be familiar with, be like the Porsche dealership where he gets his, or the Lamborghini dealership, place like that.
2008 Honda Pilot, buddy.
Okay, do we have a second?
I'll second.
Thank you. And all in favor of accepting this contract, let it be known by saying aye.
Aye.
Aye. Any opposed? None. Thank you, Melissa. Okay, moving on to Communities That Care. And is this Emma?
Yes. Hi, I'm Emma Willard. I am the Youth Substance Use Prevention Planner for Fountain Valley Communities That Care. As stated in your board packet, the contract synopsis, we're seeking your approval for the CDPHE grant renewal for the Fountain Valley Communities That Care Coalition in the amount of $292,175 for the state fiscal year of July 1, 2024 through June 30th, 2025. This grant allows us to continue our work preventing youth substance use and misuse in the Fountain Valley, addressing the availability of substances, creating opportunities for community connections for youth, addressing quality childcare in early life, and promoting the Kid Power programming for schools and families. This contract was first approved by the Board of Health in 2017, and this grant is renewable for 1 more year through June 2026. We're currently seeking approval for our 4th annual renewal in our 2nd 5-year cycle. With this grant, we're really looking forward to building the capacity of Fountain Valley Communities That Care, addressing youth substance use, and then empowering our youth in the Fountain Valley to live better lives. Are there any questions that I could answer?
Questions? No questions, doesn't look like, but I would encourage the board. I went down and got to see what you all do down at the South location and hear all about this Community That Care. And if you have the opportunity, and anybody, I know free time is at a premium, but if you ever have the free time to go down, please coordinate that with Susan. I think you would really be impressed by the work that is being done.
Thank you.
Okay, we need a motion and a second for the Communities That Care contract.
So moved.
Thank
And
you.
second.
Commissioner Bremer, and second from General Briggs. All in favor, let it be known by saying aye.
Aye.
Any opposed? None. Thank you.
Thank you.
And you're still up, right?
That's another one. That's not another
No.
different Emma.
Another Emma, sorry.
Yes, we have a
I
few
got to look
Emmas.
more than just the first word.
Good morning, everyone. My name is Emma Bernick, and I am the Injury and Violence Prevention Planner. I have 2 grants to go over with you this morning, so we'll be starting off with the Child Fatality Prevention System. We are seeking your approval for this Colorado Department of Public Health and Environment, a grant renewal for the Child Fatality Review Program in the amount of $27,250 for the state fiscal year 2024 to 2025. This funding will allow us to continue reviewing child fatalities in El Paso County that are related to motor vehicle crashes, sudden unexpected infant deaths, suicides, unintentional injuries, homicides, and undetermined causes. We are currently seeking approval for our 4th annual renewal for this contract cycle, and we look forward to continuing our fatality review and prevention work to help El Paso County children celebrate more birthdays. Are there any questions I can answer on this one for you?
General Briggs.
Having some experience with government budgets, it's down $250. What's up with that?
So that is actually for a positive reason, which is that our number of child fatalities has decreased, so we get less funding because of that.
Unheard of.
But good
But I'm
news,
glad.
right?
But that's
Larger
good news.
population and fewer child fatalities.
Yes.
That's a positive, a net positive. No other questions? All right. I need a motion and a second for the Child Fatality Prevention System contract.
So moved.
Second.
Okay, that's Commissioner Bremer for the motion and General Briggs for the second. All in favor, let it be known by saying aye.
Aye.
Aye. And any opposed? None. Moving on to the impaired driving prevention, and yes, another, Emma gets to stay now.
I do. So we are also seeking your approval for this Colorado Department of Public Health and Environment grant renewal for our impaired driving prevention efforts in the amount of $120,000 for the state fiscal year 2024 to 2025. This funding will allow us to continue developing an impaired driving prevention campaign specifically targeted at youth across El Paso County. This contract was first approved by the Board of Health in June 2023. This grant is renewable for 5 years, and we are currently seeking our 2nd annual renewal. We're excited about engaging with El Paso County's youth to make our roads safer for everyone. Are there any questions I can answer on this one?
I do have a question, Mr. President. The injury and violence prevention planner, so it sounds like they do more than this program. What's the violence prevention side of that? What's that?
Yeah, so that role is my role. And in terms of violence prevention, we do quite a bit of different things depending on the data that we receive from our child fatalities. So kind of the goal with injury and violence prevention is to focus on where we're seeing child fatalities specifically and tailor our prevention efforts towards that. So there's not a ton of super specific efforts, but working with a lot of local like domestic violence
Okay.
programs and things like that.
That's fine. Yeah, that's good. Thank you. Thanks a lot.
Dr. Vu?
Hi, Emma, thank you. I'm just curious, are our roads safer?
That's the goal with this programming, is to help make our roads safer. I know that with a lot of the data that everybody hears, El Paso County roads can be a very dangerous place to drive. However, the community has definitely noticed that trend, and there's a ton of efforts across the community and within our own agency to kind of work on that effort of making the roads safer for everybody.
Have we seen any trend since the program started? I know it's been a short period of time.
Yeah, so this program has only been up and running for about 8 months, but I will say that in terms of our outreach, we've been able to have contact with almost every single school within the county to make sure that we're implementing some form of like traffic safety expos or outreach efforts. In terms of the data, the program hasn't really been around long enough to see a specific drop in trends of different things. However, I can say that the landscape of issues that we're facing on the road has definitely changed since COVID. And so we're still kind of trying to identify what the main issues are and what we need to be targeting our efforts towards in a post-pandemic era.
Thank you.
Question. So this funding supports 0.5 FTE for the injury and violence prevention planner and 0.1 FTE for an executive administrative specialist. Is that just part of what this funding supports, or is this funding supporting only that?
No, that's just part of what this funding
Okay.
supports. The rest of the funding is going towards our development of an impaired driving prevention campaign that's going to be targeted towards youth across El Paso County, as well as our outreach efforts in different schools and other community areas.
Okay, thank you.
I'd like to add also that we heavily collaborate with existing efforts. So, for example, there are so many existing efforts with law enforcement, sheriff's office, Colorado Springs Police Department. So we don't come in as an agency and try to start our own program, what we do is enhance efforts. So when you see a 0.5 or a 0.1, we're trying to piece that together as we do with so many different grants throughout the agency on how we're pulling together collective action. And so that might seem, 0.5 of an FTE for a population of our size, and some of the increases as it relates to the concerns around some of our roads. And one of the reasons why we did get the grant was because our data does not look good in El Paso County as it relates to impaired driving. So know that we're piecing it together, and give us a little bit more time, and we'll come back with some additional information related to what what impact we're having.
Okay, thank you, thank you. In my mind, I guess even though the programs have only been around for 8 months, during those 8 months, in my mind, we have the ability to look at data over years, right? So, thank you.
And we can provide some of that data, and currently with 8 months, trying to make the connections and build the relationships and get the commitments and the action planning and those types of things are where our focus is currently at.
Yeah, and I think with, and correct me if I'm wrong, but I think with part of a year, it's even more difficult because we have different traffic trends, whether it's wintertime or summertime, and
Absolutely.
construction season versus snow, right? So-
Exactly.
All right, well, thank you very much. We need to get a motion and second for the impaired driving prevention contract.
Deborah Chan, I'd like to move to approve this contract.
Thank you.
Doris Ralston, second.
And Doris, second. All in favor, let it be known by saying aye.
Aye.
Any opposed? Thank you.
Thank you.
All right, looks like we have Jennifer now for the TEPP Community Tobacco Incentives of El Paso County.
Good morning. My name is Jennifer Lang. I'm the program manager for the Tobacco Education and Prevention Partnership, also known as TEP. As stated in the contract synopsis, we are seeking your approval for the CDPHE grant renewal for the Tobacco Education and Prevention Partnership Program in the amount of $791,153 for the state fiscal year 2025. This funding will allow us to continue our work to reduce initiation of tobacco use, decrease tobacco prevalence among youth, and also decrease exposure to secondhand smoke in El Paso County. El Paso County Public Health has been addressing tobacco prevention for approximately 25 years. CDPHE provides funding in 3-year cycles, and we are currently seeking approval for the second annual renewal within the current cycle. We look forward to collaborating with partners throughout the county who share a common goal of helping people live tobacco and vape-free. We are especially excited to award 12 middle and high schools in El Paso County with mini grants to support their tobacco-free schools policies by educating students, staff, and parents around prevention, alternatives to suspension, and cessation. Do you all have any questions?
Go ahead.
Sorry, I have the same question. Have we seen any trend in use of tobacco and vaping?
We have. The 2023 Healthy Kids Colorado data just came out last week, so we have not had a time to do a deep dive into that data. However, preliminary looking at that, I'll start with youth. The youth rate let's see, from 2015, this is the percentage of high school students who have ever used an electronic device. So back in 2015, it was nearly half at 46.2%. In 2023, that number has decreased to 30%, which is still a staggering number. However, we are pleased to see that decrease. Among adults and youth, traditional combustible cigarette usage continues to decline. And then among adult electronic usage, it is trending slightly upwards. So again, we'd like to ask for additional time to really dive deep into this data, but the preliminary numbers do show good signs among youth. However, I think we still do have a lot of work to do in our community to reduce the prevalence.
Commissioner Bremer?
Thank you. This funding has been around for a long time, I think originally out of tobacco settlement dollars given to the states and funneled through to communities to actually put actions on the ground. And I think that has moved the needle very clearly, and to the point that I'm just glad to see that as we make improvements with traditional tobacco products, I'm glad to see the ability to pivot to what our kids are dealing with now, which is not traditional cigarettes, it's vaping, and it's other things. So I'm really grateful that that however this is being directed elsewhere, that the priority is shifting with where the need is for the health of our community. I think that's significant and doesn't always happen with government grants, especially out of a settlement.
And I'm pretty sure I brought this up last time because live in eastern El Paso County. Don't lose sight of the dipping.
Oh, yes, absolutely. We do outreach events, and we'll be at El Paso County Fair in July. And we do absolutely make an effort to reach all populations throughout the county. And yes, the dip is still highly prevalent out there.
Very much. Dr. Chen, did you?
Yeah, is the age for purchasing any type of tobacco or vaping product, is that 21?
Yes, in 2019, it was raised at the federal level to tobacco 21. So yes, and that applies to combustible as well as electronic products.
Does this program have any inroads to enforcing regulation of sales?
That is primarily, so in 2020, the Department of Revenue for Colorado assumed tobacco retailer licensing, which provides a tool for, just similar to medical marijuana retailers or liquor stores. It registers all retailers that sell tobacco products, and then the Department of Revenue is responsible for going out and conducting a certain amount of enforcement activities each year. Local municipalities can absolutely step up and take even more opportunity of the tobacco retailer licensing by adopting local tobacco retailer licensing, such as Fountain and Manitou Springs were among the initial adopters back in 2011, 2012. So again, we would love to see more local municipalities adopt these laws. It just adds more and more layers to that prevention and enforcement.
Are these products available through online purchases?
They are. However, when I was reviewing the Healthy Kids Colorado data this week, and I can absolutely follow up with that information, it's a very small percentage. I don't want to give a number incorrectly, but it's very low. I would say the number one way that youth obtain products is through social sources, brothers, sisters, parents, a lot of times. Again, a lot of that information is available through Healthy Kids Colorado data, so we can follow up with that.
In addition to the increase in vaping, are we tracking the Zyn use? The teens seem to really be using a lot of those nicotine packets that are like a dip. They're called Zyns.
Yes, we're quite familiar with Zyn. They are.
That appears to be like the new thing.
Yes, they're pouches of nicotine, if you're not familiar, similar to dip, but contained in some kind of material, which I'm not really sure.
Yeah.
But yes, that is included in like a nicotine product. So when it talks about youth ever used like a nicotine-based product, that includes combustible cigarettes, the electronic devices, as well as dip and other alternative tobacco products.
The thing that scares me about the Zyn, more than vaping, more than anything else, kids now know vaping's bad, cigarettes are bad. Kids see Zyns as a way to stay awake all night instead.
And among the data for Healthy Kids Colorado, we did see an increase in the percentage of youth who increased perception of harm over the past year or two, which is wonderful. And again, through our program, through state efforts, national efforts, all of these combined efforts are, the message is getting through to youth that these products are dangerous, because it did not appear to be. maybe getting that message through a couple years ago.
Yeah, but now they see it as addictive.
It's getting, yeah, it was new and it was just water vapor, which, I hope we all know that's not the case. It's not, that contains a lot of products and chemicals. Again, the facts are getting out there to the youth, and the youth are listening.
Okay, go ahead, General.
General Briggs, so military's heavy into dipping. I'll just tell you that for sure, because I was. And the difference, just anecdotally, is it's like mainlining your nicotine, because it just goes straight into your, it's much more powerful than even smoking a cigarette. So I do think that this is something that we want to address very aggressively, having gotten off it.
Thank you. Lots of good discussion. So for this Tobacco Education Prevention Partnership, Community Tobacco Incentives contract, I need a motion and a second.
Move as
General
described.
Briggs makes the motion, and Mayor Havener has a second, and all in favor, let it be known by saying aye.
Aye.
Aye. And none, any opposed? There is none. Thank you very much.
Thank you.
Nurse Home Visiting Program. Is this Cara or Kara? Kara.
Good morning. My name is Kara Hamby. I'm the program manager for the Nurse Family Partnership Program. As stated in your board packet, we are seeking your approval for this Colorado Department of Early Childhood grant for the renewal of the Nurse Home Visitor Program in the amount of $1,586,286 for the state fiscal year of July 1, 2024 through June 30th, 2025. To continue our work, which supports first-time parents with in-home visitation by registered nurses from pregnancy through their child's second birthday. This contract has been in existence for over 20 years, implemented in 5-year increments. The grant before you today is renewable for up to 5 years as well, and we are seeking your approval. We are excited to continue the work of providing health education to families in El Paso County and are grateful for your support. Are there any questions?
I'm not seeing any questions. Do we have okay, Dr. Vu?
Very good. Kara, thank you. This is a big number. I'm just curious. Last year, do we bill for all of our indirect percentage?
That's a great question. Very close, within several $1,000s.
Thank you.
Cami? No? Okay, I need a motion for this nurse visitation program contract, and a second.
So moved.
Thank you, Mayor. And Commissioner Bremer with the second. All in favor, let it be known by saying aye.
Aye.
Aye. Any opposed? And of course, there is none. Thank you.
Thank you.
Now, Christy Durbin with the Immunization Core Services.
Good morning. Excuse me. My name is Christy Durbin. I'm the Immunization Program Manager. So as stated in your board packet and the contract synopsis, we are seeking your approval for the CDPHE grant renewal for the immunization program in the amount of $733,079 for the state fiscal year 2025 to continue our work which supports increasing immunization coverage rates in El Paso County. This contract was first approved by the Board of Health in June of 2023. This grant is renewable for 2 years, and we are currently seeking approval for our second annual renewal. We are excited about the future of continuing to serve individuals in El Paso County. Any questions?
General Briggs.
I don't have a question. I just want to speak in favor of this quite strongly. This type of immunization program helps our most vulnerable, and they would not probably get access unless there was a program like this. So, big fan.
Dr. Vu?
Can I second General Briggs' comment?
Thank you both.
Go ahead.
I just want to, I don't want to slow down today's, but I would love at some point, maybe at the work session or maybe in another board meeting to have an update on whether we've had any progress on the immunization rates in our county, because I know statewide they're a little bit low. So I would love that to be an agenda item at some point in the next 6 months.
Wonderful. Yeah, we'd be happy to provide that.
Yeah, I was just going to ask the same question, if we've seen any kind of trending. It seems like nationally, too, that my perception is that people are being more reticent to get vaccinations. I'm looking at our good doctor over there who probably could
We have
fill
seen a
us in.
decrease in our county for our immunization rates, unfortunately. We got them pretty high before the pandemic, but, folks weren't seeking as much, well child visits, and we're going to the primary care doctor as often, getting those routine vaccines. So we're a little behind, but we're doing a lot to get those rates up.
Great.
I will just add to that is that, we will provide some information as it relates to the funding and also of our staffing, because our staffing is not all that great. And I know that Commissioner Bremer, you remember back in 2018 where the Board of County Commissioners and you all had approved the critical needs funding to add additional public health nurse, which we operate primarily with grant funding. And that goes a long way because that has allowed us to go out into the community and mobile clinics, and then through some of the grant funding for COVID, we were able to expand those efforts. And so I'm happy to provide some information on that. And I'll seek a little bit of clarification as it relates to if we want to do a presentation on school age kid vaccinations and kind of narrow in, or if we were talking about the adult population, just so we're targeted there.
I think what I'm interested in are the traditional childhood vaccines.
Yep.
Yeah, we definitely have data.
That's where we make some progress.
Thank you. Yeah, we look forward to diving a little bit more deeper with that presentation.
Okay, we need a motion and a second for the immunization core services.
So moved.
Okay, thank you, Mayor. And Dr. Vu is second. All in favor, let it be known by saying aye.
Aye.
Aye. Any opposed? And of course, there's none. Thank you, Christy. Tuberculosis control and prevention.
Yes. Yep. Sorry. My name's Aaron Huser. I'm the nurse supervisor for the tuberculosis department here. So we're seeking approval today for a CDPHE grant renewal for the tuberculosis program in the amount of $90,000 for the state fiscal year of July 1, 2024 to June 30, 2025. And so this will support our work in TB treatment, evaluation, and education. The contract was initially approved in June of 2023. It's renewable for 4 additional years, and we're currently seeking our approval for the first annual renewal. So, and we look forward to continue to provide expert TB care to the county. Any questions about the grant?
Dr. Vu.
I guess similar question. Has there been a trend in tuberculosis, either active or latent?
Yeah, so we're actually pretty consistent over the last 5 years. So since 2019, our peak has been 8 cases. We typically go between 3 and 8 cases over the last 5 years is the range that we've been in. So in 2022, and this is the calendar year, we had 3 cases. In 2023, we had 5. Latent tuberculosis is a little tougher to pin down. We don't treat all of those cases, and so a lot of our medical providers in the community will treat those as well. So Peak Vista has been treating quite a few of the refugee cases of latent tuberculosis lately. So it would appear that our numbers probably in the 2024 year are going to look lower than 2023. It doesn't mean there's less latent tuberculosis, just that El Paso County may not be the ones treating it. We're providing a lot of consultation around that. So, so we had 30 cases in 2023 of latent tuberculosis that were identified and treated of latent tuberculosis. Yeah.
Okay, so sounds like cases have not increased. And we may or may not know. Do you know, and this question came up before, would you know if there is more refugees or migrants to El Paso County over the last year or 2?
So we did meet with Lutheran Family Services recently, and they sponsor people on immigrating into the county. There has been, I don't have specific numbers or anything, but there's been a pretty good increase over the last couple of years as far as immigration. Yeah.
Thank you. Maybe too early to know the trend.
Yeah, and I just don't have that data in front of me. They had a lot of great tables and things for us to look at, but yeah.
Thank you.
You bet.
Well, what I'd like to do also is that we can follow up with the Lutheran and get you information, because there's a difference between immigration, migrants. I mean, there's different categories. So if it's okay, because not to cause any confusion, I would like to follow up with that so we're
Sure, yeah.
clearer.
Go ahead.
I would request that presentation, because public health, we should be on top of this. We shouldn't farm it out to, who was it that's doing the cases? Well, Lutheran's bringing them here, but
Peak Vista.
Peak
And so
Vista.
they are, we've had a long-term relationship with Peak Vista, and where we have partnered for years with tuberculosis and many different other aspects as well.
we should be absolutely aware, though, of the cases so that we can answer Dr. Vu's questions and not, for other reasons, not want to know the information or find it inconvenient to find out the actual numbers. So I look forward to that, and I hope it's very soon. In fact, within the next meeting or two, that would
Sure,
be useful.
we can do that, and we'll provide clarification as it relates to latent TB related
Right.
to that's non-infectious, non-communicable, and then there's the active TB, which is very concerning. So we can provide all of that information sooner than later, Dr. Donaldson.
Mhm.
So
Not
this
non-infectious at
sorry.
the moment, but
Correct.
could become infectious at any time that person's immune system heads south. Correct?
Yes.
Yeah.
And I did want to point out that latent TB is not something that's reportable to us as well. So if a physician identifies a latent tuberculosis infection and treats that patient, they won't necessarily have to report that to us. So that could be any medical provider in the community.
So a provider tests a patient, they test positive, and so we just don't have a clue on what the numbers are.
There's not a way to identify that. Typically, though, if providers are asking questions around this, they will a lot of times consult us on like how to treat or if there's any additional
Right.
testing.
And I
So-
used to do this, and it all depends on how big the reaction is and if they've been treated and if they've received the other form of immunization, which is used in other countries. I've kind of forgotten half that stuff.
Yeah.
But my role here on this board, the Board of Health for the county, would be to ensure we're doing everything we can for the citizens of this county to be aware of what's going on and not want to know the numbers. And I think this is going on even with crime numbers right now in this county, because some people are afraid of what might happen if we know the numbers. So I would just ask that we become very aware and keep an eye on
Well,
it.
and I will say that I keep in touch with my staff on a routine basis as it relates to different populations, and if there's any uniqueness as it relates to some of our ongoing work. And so we do want to know, and so this organization is not an organization that doesn't want to know, so I do want to just clarify that, and we'll come back because I think it's really important that we're clear on what we're talking about, what specific populations, related to what is latent TB, what is active TB, when do we get involved, what is our authority, what is our responsibility. I take that very seriously, and Dr. Albanese has stepped up, so I'd like to give you an opportunity to maybe provide additional information.
Yeah, no, Aaron was doing perfectly. I was just here in case things got a little more. So latent TB disease is not a reportable condition in Colorado. That's where reportable conditions start at the state and the State Board of Health. So that said, we, as part of TB prevention, we serve both a treatment and a support role to assist providers in the community who are really upfront interacting with patients who may have risk factors for latent TB infection, to ensure that they get tested, and then to assist in sort of the world, the provider support to treat latent TB infection so it doesn't convert later to someone who develops sort of what I say the TB wake up in the lungs, and then potentially cause illness. And then at that point in time, those are the cases that are pretty much exclusively under the care of any local health department and the state health department. So this infrastructure, and I will tell you from my time here back 15 years ago, was building that infrastructure was a big priority back then, and I'm sort of proud to see and hear when I came back to work at the agency that it still exists. And so, it is, latent TB management is a partnership with community providers. And so we encourage that and we support that, and Aaron's team provides consultative services for that. We help help providers evaluate someone. I'm not really sure which side of the fence is this individual on who tested positive for TB. We get those consults continually. I support Aaron and the nurses and his staff to help make that evaluation. We do testing to ensure that it's not active infectious TB versus not. So this is daily, weekly, monthly routine work for the agency. But when someone who's not having symptoms, not contagious, not a threat to the community, to encourage them to take several months of medication. Unfortunately, TB is not so easy, right? You have to take 4+ months of medication. So that's why that relationship with providers ends up being really important, who have that individual as an established patient and a history with the patient, and sometimes they're the ones that are actually more successful getting treatment into the individual. But we can go into all of that further.
Yeah, I look forward to the presentation or the information, and I think I look forward to trends too. The exact question is Dr. Vu was asking, what are the trends? Thanks.
I have a question here. Looking at this, it appears that you do, identify, treat, and contact trace through this program. Does this program also have any type of surveillance, especially based on demographic data?
We don't necessarily surveil the community. So a lot of the patients that we get will come through, like for instance, if someone's immigrating, they may come to us if they're like a Class B. It would be someone that's something abnormal is identified during their immigration process, like an abnormal chest X-ray or something like that. So we don't do surveillance where we go out and test at large or anything of that nature. Is that what you mean? Or?
Yeah, are you clarifying, do we have demographic characteristics of our TB cases? The answer is yes, we do. For
Okay,
active
and
TB
so-
cases. I think Aaron is interpreting your question one way, and I'm interpreting.
It's kind of both because, I would say that maybe based on demographic data, one of the ways of getting people into early treatment and then maybe reducing the number of potential contacts is some sort of surveillance or outreach for additional testing in these groups that may have higher rates of unidentified TB.
Yeah, and I think this is starting to probably getting a little bit into the details that are probably best addressed, President, to move on. So there is already a robust screening process for many people who enter this country enter the United States from another country, and so we can go through that, and so many of the patients that we receive because of that screening, and so upon immediate arrival in the United States, they become our clients.
So
But we can go into those details.
we're kind of assuming that it's an immigration population, but I'm also thinking, because I don't know that information, whether it's the migrated population or whether it's, say, homeless or HIV or,
A mix of that.
All good discussions, and I think we are going to get a presentation of further information relating to this in the future. But right now, we are here to vote on a contract renewal. And it sounds like this is a area that we all have an interest in, and certainly a disease that we don't want to see become prevalent. So I'm going to see if we have a motion and a second to accept this ongoing contract.
Yeah, Mr. President, I'll move the motion, and I would ask that we get that briefing within 2 months, within 2 meetings.
Okay, and keep in mind, 2 meetings will take us 3 months out because we'd miss our July meeting. So hopefully we'll try to get it in August, okay?
Okay.
I'll second that motion.
All right, we have a motion by Councilman Donaldson, second by Dr. Chen. All in favor, let it be known by saying aye.
Aye.
Aye. Any opposed? And of course, there's none. Okay. Let's see what's next. Congenial syphilis prevention. Good morning.
I'm Dr. Peterson. I'm the family nurse practitioner with Reproductive Health Clinic.
I'm Paul Mayer, co-medical director.
All right, so as stated in your board packet, in the contract synopsis, we are seeking your approval for the CDPHE grant renewal for the syphilis prevention program being conducted at the El Paso County Criminal Justice Center, or CJC, in the amount of $407,872.33 for the state fiscal year July 2024 through June 2025. These funds will allow us to continue to identify and address new cases of congenital syphilis by screening, identifying, and treating syphilis in high-risk persons of reproductive age in El Paso County. In partnership with the El Paso County Criminal Justice Center, excuse me, the Reproductive Health Clinic will continue to implement this program by conducting chlamydia, gonorrhea, HIV, and syphilis screenings when a female of reproductive age presents to the facility for intake. This project seeks to provide early identification of syphilis, access to treatment and referrals, as well as linkage to prenatal care services. This in turn will positively impact the risk burden of syphilis transmission between mother and child in El Paso County, as well as benefit persons of reproductive age. This contract was first approved by the Board of Health in July of 2023. This grant is renewable for an additional 4 years, and we are currently seeking approval for our second annual renewal. We're looking forward to continuing to serve this unique patient population. Are there any questions?
Looks like Commissioner Bremer.
No questions. I just wanted to say, again, with my county commissioner hat on, thank you for your cooperation with our El Paso County criminal justice system and our sheriff's office and deputies that run that program and do the intakes. So thank you very much for just the collaboration and cooperation and seeing that as an opportunity to actually impact health of the community.
General Briggs.
I mentioned this before, but in that theme, it's good to note that the local folks have been wonderful to work with. And when we talk to other programs around the state, that's key. The jail staff are supportive, it works well, which is why our program is working so hard now. So they've been wonderful to work with.
General Briggs.
Yes, thank you. So at the Rescue Mission, of course, we have a significant part of the population that's justice involved. So I know the documentation talks about intake, but is there any testing post-intake? Meaning if someone identifies with an STD, how are they retested before they're released?
Yeah, so the patient population, if they test positive, they are treated immediately by the staff nurses, and then they are invited to come to our clinic, our reproductive health clinic, and we've actually had the opportunity to follow up and do more education and, pap smears with that population.
Can I have a follow-up question? So you use the word invited as opposed to mandatory?
We can't do mandatory.
Is the initial intake mandatory? Okay.
Do you have information on rates of successful follow-up? I mean, you don't have to present it now, but, like generally, do you have that information?
So since the initiation of the program, December 23, up until the beginning of this month, we have served or tested 237.
May I just stop really quick here? So I want to be very mindful of releasing any data specific to the jail population. I know that we have that, and we can talk about some of the information, but if you're okay with it, I would just like to, I'm very, releasing
incomplete?
information, you know, for the sheriff's jail, I'm just, I'd like to put pause on that if that's okay, and we can come back, but that's a certain population, right? Maybe about 1,000, so plus, we're talking about women, and then you could narrow in, and as it relates to HIPAA, I want to be very mindful of what that might involve related to identifying information.
I think a question that can be asked and answered is, what is the follow-up? How many people follow through with the invitation that is given after they've been initially, even a percentage, so we don't need to know numbers.
Percentages are fine. I don't
Yeah.
want to go into, like, you know, there were 200 people tested and, you know, we found 50, or like percentages I think are fine.
I don't specifically have percentages at
Okay.
this time. I know that a few of the women we have seen, but
Yeah.
certainly we can.
Let's do that and keep it to percentages. If you could just let us know how many people follow through with treatment after they've been identified as positive, get the initial care, what percentage follows up with ongoing care through us? Maybe they might have personal
This program does track
physicians.
those rates, right? Those rates are tracked, right? As part of this program.
Yeah, part of that, the disease intervention specialist with the state will follow also those cases, and so we can get all those numbers.
Okay.
Just realize that this population is, by intent, a very difficult to serve population.
Understood.
That is why we're in jail. And we know a lot of data, the general syphilis, pregnant syphilis, so often they get diagnosed and never treated because they never follow up. So this is a little snippet in time, and we can treat them at least with one shot. So many come in and out so quickly. Sometimes you only get one shot in, sometimes it's a 3-shot series. So it's a tough group to serve. We'll get those numbers, but just realize we're intentionally trying to serve a very difficult to serve population.
Understood, and that's the intent of the program, why you're in the jail in the first place. Yeah, I think we all understand that. Councilman Donaldson.
Yeah, thanks, Mr. President. And I would disagree that we're going to have some kind of HIPAA violation if we say that there were 260 people tested and 50 of them tested positive. I see the medical director is going to step up. So I think we can do it at a different time. But honestly, I think everybody on the board supports this program, and it helps us support it, but to hear some numbers. And to just hear a percentages are really not very useful, because you don't know, is that out of 3 people or 3,000 people? So they're not that helpful. I think it's a very reasonable question that was asked.
Understood. And Dr. Albanese, if you have some additional information, and if you agree to share that detailed information, my next steps will be to, follow up with our insurance provider, COPIC, where I get more detailed information around HIPAA to make sure that I'm not crossing any lines. But, maybe I'm incorrect. I just don't want to have to reel something back, as this is a relatively new program, and I value the partnership with our sheriff's office, and I just, I'm unsure, and so I'll be honest about that. And so, Dr. Albanese, if you have information about if it's not identifying information and you're good with it, then
Sure.
I am too.
It is potentially identifying information. We actually have statutory requirements on data sharing. This is a notifiable condition as well, and there's statutory requirements on the level of detail that we are permitted to share publicly and to ensure that it wouldn't potentially be identifiable. And unfortunately, with the small number of female inmates at the jail, that is a problem. So we can, but there are ways to repackage data to protect confidentiality and stay true to our statutory requirements. I just think off the cuff, it's difficult to do that for today, but we have this data, we've looked at it, and we will package it in a way that meets our requirements, and we will confirm that with CDPHE.
I appreciate that. But over a 7-month period, a changing population of 1,000 people, and some of them get tested, we don't even know which ones, and then some of them have a disease. I'd say there's no way to figure out who we're talking about in there.
We have standard procedures to do this with data work and with CDPHE, so we will take a look at it.
Okay.
But I think it's best done.
I would ask the executive director to strongly consider the desires of the board.
Thank you, Commissioner Donaldson. I think we all understand that we'd like to know the effectiveness of the program. That's the bottom line. We just want to know how well it's doing. And along with that, when you present that information, however it comes forward to us, I'd like to know how many other similar programs are there in the state and other counties? Are there, I would assume there's a lot of counties and detention centers that aren't being served in this manner.
Well, it's interesting, the governor's new public health order, of course, all, yes, with the governor's public health order, of course, all jails are now required to test women who are pregnant for syphilis, so all of them are now going to have to
Okay.
start doing some version of this. And it's just a bit of good luck that we happen to be already doing this with our local jails, so we've actually been a good partner with them because they're now meeting that requirement because of our program. As far as, I know Pueblo and Jefferson County are both have grants to do a very similar program as this, and I believe one other, but I know of two for sure.
Okay.
And Pueblo was the first, and they were very helpful for us as we got started.
And again, I think the board is, with the various comments, you're reading that we're interested in this and supportive of the program, and you're definitely reaching a population that a year ago was not being reached. And so we're very grateful for that. But as with all of our programs, understanding the impact that we're having is good understanding for each of us that sits on the board.
Yeah, I can tell you in broad terms, it's a very effective program. We've made some very meaningful interventions that I think will have a significant lifelong benefit for people. So yes, it is a very relevant program. There's no doubt about that.
Understood. Okay, I'm sorry. Well, I guess you are a doctor too, but General Briggs.
I have a question about just the scale of increase. Is that because it's going to be funded for a full year as opposed to a partial year? Because we're going from basically 300,000 to 400,000.
It's gone up $100,000. So.
I believe so. Yeah. So.
I don't have that, I don't have that information for you, I'm sorry. I can get it for you.
I think I recall the last time that this all came before you is that it wasn't a full year, and this is a full year.
Okay, can we just confirm that, I guess?
Yes.
Yeah. And Dr. Vu?
Yes, that was my question. What was the reason for the increase in amount?
I'm just grateful that it wasn't a decrease, so.
Unless the reason for increase is, the higher rate.
Yeah. Mm-hmm.
I will confirm that, and I also will make the questions as it relates to data priority, and do understand that that's very important to you all. I also wanted to mention that I spoke with the Sheriff Roybal, and he had asked if we wanted to provide some of his staff here in support of the contract. I didn't think that was necessary, but I did want to let you all know that he's very supportive of this effort too, in alignment with you all also.
Okay, I'm going to look for a motion and a second to accept this ongoing contract for the congenital syphilis prevention program.
I'll move to approve this contract.
Thank you, Dr. Chan.
A second.
And Doris for the second. All in favor, let it be known by saying aye.
Aye.
Aye. Any opposed? And there's none. Thank you both very much. Now, the federal Title 10 Family Planning and Colorado State General Funds, Reproductive Health. Is that you again?
It is.
Okay.
It is. As stated in your board packets, in the contract synopsis, we are seeking your approval for this CDPHE grant renewal for the Title 10 grant in the amount of $298,577 for the federal and state fiscal year June 2024 through July 2025. These funds will allow us to continue our work, which supports and assists individuals in determining the number and spacing of their children, which in turn promotes positive birth outcomes and healthy families. The program provides a number of important preventative health services, including patient education and counseling, pelvic examinations, cancer screening, pregnancy confirmation and counseling, as well as sexually transmitted infection prevention education, counseling, testing, treatment, and referral. By law, Title X funds may not be used for programs in which abortion is a method of family planning. Family planning programs reduce unplanned pregnancies and provide services that reduce the number of sexually transmitted infections in the local community. This contract was first approved by the Board of Health in June of 2020. This grant is renewable for an additional 4 years, and we are currently seeking approval for our 4th annual renewal. We're looking forward to continuing to serve families in the El Paso County. Are there any questions?
Okay, I'm going to be the one to ask a question this time. I'm just looking at the numbers, and it looks like in 2019, we had nearly, 800 more clinic visits than we do currently. Why was so high then, and why have we seen a decrease? Do we know?
Yeah, so the effects of COVID and the clinic having been shut down for 4 months,
Oh, okay.
a lot of clients went elsewhere. And so now, this year, we've actually noticed a big
They're
trend
climbing.
up, and we're projecting for 2024-25, there being even more.
I should have known. COVID
Word's
is the
getting
culprit.
around that we're really good at what we do. Yeah.
Any other questions for this contract? If not, I'll look for a motion and a second.
I'll move approval.
Thank you, Commissioner Bremer. Second.
I'll second.
Thank you, Dr. Chan. All in favor, let it be known by saying aye.
Aye.
And any opposed? There's none. And we get to our last one, the Public Health Core Services Funding. Director Whelan.
Okay. If you all remember, a few months ago, I had spoke about our state funding being discussed at the state legislature, and asking for support to reach out to our representatives, Paul Lundeen, Mark Schneider, and Tony Exum, because the state funding that was provided, the additional state funding that was provided for a 3-year time period was, I don't want to say cut, but it was not extended. And so in this legislative session, the ask for the Joint Budget Committee was to increase statewide funding from what was provided at $7.5 million to 55 local public health departments. The ask was to increase that to $12 million, and what the long bill includes now in this contract is that it's a total of $11 million for 55 local public health departments. And that's what you see, the additional $50,000 for the environmental health services. And then we also have a resolution, because this is new funding that was not included in your original adopted budget in 2024, in the amount of $316,831. But the total for the funding each year should be at $1.7 million for core public health services. And what this funding is for is the services such as public health infrastructure, the planning and assessment, the environmental health, communicable disease and prevention and control, and population health, laboratory and administration, and governance. So this is the funding that we use when grants do not cover their cost and we still need to do the service. So when General Briggs, you point out that the $27,000 for child fatality review team to take action on the population of 17 years of age and younger, we utilize funding that comes from the state, and then also with El Paso County dollars to hire some of the staffing that we need as it relates to some of the priorities. And as an example, funding we used to call it a youth suicide prevention planner. and the title has changed to more to a strength-based and in that work. But these are the kinds of, these funds are not restricted and not limited, and so we're able to fund various different infrastructure needs in our agency. And with that, seeking your approval, and if there are any questions, I'm happy to answer those, and we do have a resolution to approve the new funding.
So the contract already includes the amount that's included in the resolution, right?
Yes.
Okay.
So, kind of piecing that together, Lori, I'm looking to you. If the contract already includes the amount that is in the resolution, if I call for a vote on the contract and approve the contract, am I also approving the resolution at the same time, or do I have to do those separately?
I don't think you're being asked to approve the contract. I think you're being asked to recognize the additional revenue that came with the change in the contract amount. So this is more of a budgetary type resolution than a contract approval,
So we'd be voting on the resolution
to recognize the additional revenue.
Understood.
Correct.
Questions from the board? Go ahead, Dr. Booth.
Thank you, Susan. It's another big number. The indirect percentage from last year, will we be able to bill for all of it?
Yes.
Thank you.
And I just going to ask, because I want to make sure I heard some of those numbers right. The state overall funding is 11 million?
So, yes, and so statewide, in the long bill, they are funding local public health agencies as well as the state health department in the core services. It used to be known as per capita funding. What that means to El Paso County is we have received this funding in my 20-plus years here, and for a population our size, we used to get a little bit over $900,000, not even $1 million for core services. Now with the past few years, there was an increase in funding statewide at $7.5 million, where went to local public health. Now it is up to $11 million that will stay steady. And so our amount that we will get yearly is $1.7 million.
Well, and, I guess that's where I was heading. I just think it's remarkable that out of a state budget of $11 million, we're seeing 1.7, and there are 55 counties in our state, so some of them are getting very little money for their ongoing efforts. Now, granted, we are the largest. That doesn't go unrecognized. We're the largest, most populous county, but it makes me really feel for those others that are getting, you can only split that money so many ways, and splitting it among 55 counties, when I see the amount that we're getting, some of those other counties, it makes me feel for them. They don't have much in the way of state funding.
And they do, with this funding, it is, the funding formula takes in consideration the population.
Understood.
And not all funding does that. And the state is very aware. We have a Colorado Association of Local Public Health officials where there are large populations like ours, and then there are more of the smaller. And so there are considerations that are taken into account in how to make the most use of some of the funding for the smaller counties. And I will say, when we're talking about a population, the most populous county in the state, $1.7 million doesn't go far either. However, I always tell people that we do a lot with what we're given. I mean, we're the first accredited health department in the state of Colorado. We're the second reaccredited. We also have Project Public Health Ready for emergency preparedness, that designation. And so what we're able to accomplish is extremely impressive related to the amount of funding and the staffing that we do have. But this is very exciting, and if you see our state representatives such as Paul Lundeen and Mark Schneider and Tony Exum, thank them because they worked with their colleagues on the Joint Budget Committee, and they provided information that I provided to them to support the extension and also the increase to support public health in the state of Colorado. And I am extremely grateful, and I think that this is this is significant, ongoing funding from the state per capita. I think it's significant, so very, very grateful.
So, and Lori, correct me if I restate this incorrectly, but we are now voting for the increase. There's a resolution, and I'll look to the board. I don't think we need to have the whole resolution read into the minutes, but if you'd like to, we can. But the resolution is for the increased funding of $300,000+, correct?
Correct. It's, again, it's a budgetary record-keeping type resolution to recognize that additional revenue that we
Okay.
are receiving.
I'll make a motion to approve Resolution 7 of 2024.
That's what we're doing
That
now.
is the resolution.
Yeah.
Resolution 7 of 2024.
Lori mentioned that we don't have to approve the contract renewal per se. I'll let you state it.
So, yes, this is not a resolution to approve a contract renewal or a contract amendment. It's simply to recognize additional revenue that the county is being provided through the state budgetary process.
But, Mr. President, I think we need to approve both. We need to approve the contract, and we need to approve the
Okay.
resolution with the additional funds.
316,831 on that increase to 1.717 is in the resolution. It's specified in the
Check.
first paragraph.
I check, but we can even hear from the attorney. I think we need to approve both.
Susan, I'm sorry, can you clarify, this is tied to a specific contract?
So previously, the board has approved the state funding. The additional funding is in the amount of $316,831, but previously, the board has approved the funding, and
I guess my question is the funding provided through a written contract signed by both parties, or is it just funding that's, direct funding that's provided? What I'm asking is there a contract that has been previously approved, or is this just funding that we receive that's not tied to a specific contract?
so this funding does come through a contract.
Okay.
And yes, so there, it is a contract that has previously been approved by the board.
Okay.
And there should be an additional contract that comes for approval for me and from the board allowing us to receive the additional funding is what I understand that where the vote needs to take place, because we are recognizing new revenue beyond what our original adopted budget was.
Right, so this is a budgetary, the resolution relates to the budgetary item. Is there also a contract amendment before us today, or will that be forthcoming? Or, I think that's what the board members are asking.
And in order to be safe, I would recommend approving this contract that's before you in the synopsis.
Okay, so there is a
Just to be safe,
contract.
because there is a contract, and the resolution is to recognize the additional funding. And I will say, just to be safe, I would prefer to do that, so I don't have to come back and potentially say that there was a contract that needed to be approved. So the previous contract that was approved wasn't at $1.7 million.
Right, right. It wasn't clear to me that there was a contract associated with this revenue stream. That's what I was trying to get at. So yes, I would agree that we need to approve the contract amendment as well as recognize the revenue. And that can be done in a single motion or two separate motions.
You have us here. It costs us nothing. I think we should do this.
So then we can just alter the motion.
Okay, well, here's what we're going to do. We're going to do two. We're going to do the contract first. Let's get a
So
motion
moved.
for the contract
So
from.
moved.
Second.
Okay, Councilman Donaldson makes the motion, second from General Briggs. All in favor, let me know by saying aye.
Aye.
Any opposed? All right. Now we're going to move on to the resolution to accept the additional revenue that is coming from the state. And I'll just look for a motion on that.
So moved.
Okay, moved by Doris, and I'll take the second from
Second.
Councilman Donaldson. All in favor, let it be known by saying aye. Oh, wait, we have discussion here. Dr. Vu.
Can someone explain to me the numbers 1.717396 compared to 1.715? 927.
Sarah, do you want to explain that?
Excuse me, should speak into the microphone. Sorry, difference there is that $316,831. I think if that was your question, sir. And so what this really is we had budgeted conservatively for the state funding because we didn't know that the long bill would be passed. We certainly hoped for that, but we budget conservatively to what we know. This is a higher contract amount that was passed, and so that difference is the $316,831. So we were anticipating a contract from the state, just not with this higher amount. So this is good news.
So should the numbers be switched? Meaning the old contract is 117.15 or 1715, and the new contract is the higher number?
Well,
I'm
there's.
dragging my knuckles to this
Oh,
math
let me
problem
clarify
here,
that.
but-
Oh, very good. So
core
the contract
services
review.
funding mentioned in the resolution is not the same as the,
Very
as the
good, ma'am.
contract, as the
Yeah.
proposed contract that we just approved.
Yes, I can clarify for you. So our state fiscal year runs on a different schedule than our calendar year budget for the county budgeting process. So the previous contract amount that you see there spans 2 calendar years of county funding. And so if you actually do the math on this and you, I'm hesitant to do public math, so I won't say the specific number, but if you look at the previous contract amount and you divide it by 2, the 1.7, $18,685, half of that money is in our calendar year budget for 2024. This new fiscal year 2025 state contract amount of $1,715,927, if you divide that by 2, that half of the 6 months will fall in this calendar year budget. And so when we created the state LPHA funding budget for your calendar year for 2024, we accounted for half of the funding from last year's contract, as well as the potential funding we anticipated budgeting for this last 6 months. And so that
Thank you.
316,000, let me read it here, $831 is the difference in what we had budgeted for this other 6 months.
Thank you.
It is a bit complex, and so I can put this in writing for you as well, so you can double
It's
check
okay.
way.
I understand now.
It's
Thank you.
clear.
Thank
That-
you.
As long as it's not a typo.
Okay, yes, sir.
Thank you.
All right.
Okay, we're right up to the vote part. We had a motion and a second. All in favor, let it be known by saying aye.
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 Any opposed? Thank you very much. We did make our way through all of that. That brings us to item 9 on our agenda, which is a resolution. There were some emails that went back and forth among the board members with regard to Lori's request to continue to be able to use listservs, which is a kind of a legal chat board, for lack of a better term, where you get to exchange ideas with other attorneys. And the board voiced their approval with that, but anything you want to add?
I'm happy to provide a further explanation or context for the board if you would like. In a nutshell, licensed attorneys are bound by the Colorado Rules of Professional Conduct. You can insert your own lawyer joke there. But Rule 1.6 provides that a lawyer shall not reveal information relating to the representation of a client unless the client gives informed consent. And that prohibits us from identifying who our clients are, what the subject matter or circumstances of the representation of that particular client are. And the American Bar Association recently released an opinion, and again, this is just an opinion, it's not a rule. It may inform interpretation of the Colorado rule, but the American Bar Association's opinion states that Rule 1.6 prohibits a lawyer from posting questions or having discussions on a listserv. So I, as a member of the El Paso County Attorney's Office, am a member of a listserv that is supported by the Colorado County Attorneys Association. So it is a listserv that is attended by or available to all of the counties in the state, all the county attorneys in the state, and we find it a useful resource to discuss specific legal issues that are specific to counties, because there are very few of us out there that practice this kind of law. It's not like real estate or commercial law. It's a very specialized area of law, and having that listserv available to ask questions and have discussions about either the interpretation of statutes, the interpretation of regulations, or even specific circumstances that we may find ourselves in without naming parties, is very helpful. It is impossible to participate in those listservs without someone knowing who our client is, because we're county attorneys. Our client is the county. And once we ask the question, they're going to know what the subject matter of the representation is. So to give you a couple of examples, it was very useful during the first few months of COVID, because we had all of these executive orders and CDPHE orders flying out on an almost daily basis. And to have a forum in which we could discuss, what does this mean? This one conflicts with this one. How do you interpret that? How are you enforcing these orders? Having those conversations with other attorneys on these related legal issues is very helpful.
Can be a force multiplier, it sounds like.
Right. You know, another hot topic, just as an example right now, are septic systems, OWTS systems. A lot of counties are struggling with enforcing those regulations. So there's some discussion going on about the tools that we have available to us to enforce those regulations. So what I'm seeking today is your informed consent, which is what is provided by these rules, to continue to participate in these listserv discussions for the benefit of, for what I think is a benefit in us providing our legal services to you. This has also been presented to the Board of County Commissioners in terms of our office's representation of the board and their various departments, and I believe it was approved. So that's what I'm seeking from you today, and I'm happy to answer any questions.
Go ahead.
Thank you. This is complex. I just want to make sure my understanding is correct. So listservs is a legal platform, and there's an opinion about Rule 1.6 that prohibits us, for example, from posting questions or comments relating to representation and listservs. It's an opinion, and your request is that even though it's an opinion against posting it, your question is, can we continue to post comments or questions regarding our representation? Is that correct?
I want to clarify it a little bit, Dr. Vu. Listservs in general are just an internet tool for a group of people to get together and on a particular forum or through a particular group of emails and have a discussion.
Gotcha.
There are two listservs that I'm a member of. One is a national listserv that I very rarely use. The more common one is through the Colorado County Attorneys Association. So it's just basically by sending a single email, I can blast it to all 64 counties and vice versa. We have not up to this point interpreted our rules of professional conduct to prevent us from participating in those listservs. Now we have an opinion, again, it's not an enforceable rule, but we have an opinion that that activity does in fact violate this particular rule. The rule does allow us to engage in this type of activity with a client's informed consent. Because the Board of Health is one of my clients, I and my office are seeking that informed consent to allow us to continue to participate in these listservs.
Understand. Thank you. That is very clear. A follow-up question, where does that opinion come from? Rule 1.6 prohibits?
I believe the rules of professional conduct are adopted by our Colorado Supreme Court.
So the opinion is from Colorado
The
Springs
opinion is
courts?
from the American Bar Association.
Gotcha. Okay, understand. Outside of American Bar Association, are there other opinions?
Not that I'm aware of. But
And-
these opinions are very persuasive
Yes.
when it comes to the Colorado Supreme Court
Yes.
and our Office of Regulatory Counsel enforcing our rules of professional
Right,
conduct.
American Bar Association, of course. So I'm also assuming other attorneys from other counties are also using this platform currently to discuss their questions or comments relating to their own representations.
Yes.
And I'm assuming that they are also seeking
Informed consent.
informed consents from their clients.
Yes, that was a topic of listserv discussion.
Perfect.
Yes.
Thank you. Now I'm clear.
Any other questions?
All right, we have a resolution that is stating just that. And I'll look for a motion and a second for that resolution.
I moved informed consent to use of legal listservs.
Okay, that was Doris Ralston with the motion and Glant Havener with the second. All in favor, let it be known by saying aye.
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 Any opposed? There is none.
Thank you.
That takes us to our director's report.
I have nothing to add.
Okay. Prior to our motion to adjourn, I would just like to ask the board, we have an upcoming work session, and during today's discussion, we had a lot of items going Susan's way, and several of them she said we could bring up at the board session. I would like permission from the board to be able to work with Susan and see, for the two of us to determine which of those can be sent out informationally via email to us, and which ones we will actually have a discussion and presentation at the board work session.
Mr. President, is the board work session going to be televised as these meetings are?
I don't know. I don't think so. I don't think it has been our intention
Okay.
to do so.
Then the information about tuberculosis, I would ask to come back to this setting so that it can be received by the general public, media, et cetera.
Okay.
And if you're okay with this, we can plan on a presentation during the August routine meeting.
Yep.
Yeah, that's fine. That's fine. And we could do it at both. I mean, we could go into more depth there and just a brief.
And that's my
rehash.
intention, is that we've got a very full day scheduled for that work session, and I don't want to overburden us with too many things so we don't get anything accomplished. So with your permission, I'll sit with Susan, and we'll determine our agenda for the work session, and other things will be informational, and others, as you mentioned, Commissioner Donaldson, will be presented at a regular board meeting, a scheduled board meeting.
How far in
good?
advance of the work session would you anticipate that informational emails would be sent out?
It really depends on capacity and staffing. I took a number of notes as it relates to some of the data requests, and so we'll get going on that. And I think some of the priorities, that I was hearing as it relates to some of those requests, and just like I've worked with you, like if something's more easily available, then I will be able to share that. And I do encourage, anytime you have a question or data request, Dr. Chan had reached out to me to ask me about some outcome data and some trend data, and I really appreciated the opportunity to work with my staff to take a couple of weeks to provide that. So it really depends, but if you want to make sure that there's something that I'm not missing as a priority that you need right away, then we can accelerate that if needed.
Oh, okay. It's just a general question,
Okay.
just so that there would be time for us to digest that information in advance of the work session. I mean, if it's like a day or two, I don't know if I would be able to.
No, we'll try to get the
digest-
agenda out for the work session as soon as we can, so
Okay.
that people know what we're going, the items that we'll tackle during the work session.
Yeah, I would anticipate at least a couple weeks in advance
Yeah.
of the work session where we would have an outline. As far as some of the data requests and reports that, we'll try to get that information out quickly also.
Okay.
Mhm.
Thank you.
Okay, looking for a motion
I'll
to
move
adjourn.
to adjourn.
Okay, thank you, Dr. Chan. A second?
Second.
And
General
all in favor, let it be known by saying aye.
Aye.
Aye. Thank you. Oh, forgot that part.